Now to the city of trouble and the row between Governor Mike Sonko and Nairobi Metropolitan Services Director General Mohammed Badi continues to escalate over the allocation of health funds. Sonko, in a rejoinder, has categorically stated that no law allows a county government to finance the operations of the Office of the President where the NMS is domiciled. This after NMS Director General Mohammed Badi accused the Sonko administration of denying it funds to enhance health service delivery, leading to the Pumwani saga of a mother delivering outside the hospital.
The Nairobi Governor, Mike Sonko, in an official statement has stamped the NMS position before the Senate's Health Committee, which ascribed blame for the Pumwani Maternity Hospital saga to the county government as escapist and insensitive. Sonko further stating that the Nairobi County Public Service remains the employer of all the seconded staff and that nothing stops the seconded staff from executing their duties as per the contracts of employment. Sonko further refuted NMS' claim that his administration is denying them 127 million shillings meant to benefit health centres. The money said to be held in a special purpose account of the county at Central Bank. The county is yet to change signatories to their account to NMS officers, adding that NMS is fully aware that there is no provision in law that allows a county government to finance the operations of the Office of the President, in which the NMS falls under. Sonko further stating that his administration is under pressure from the Auditor General to account for 294 million shillings allocated to fight the COVID-19 pandemic. The NMS's report on the Pumwani Maternity Hospital, submitted to the Senate Committees on Health, has found 3 security guards, employees of Hatari Security Guards, liable, having denied entry to Miss Jacqueline Faustine and her husband to the facility on the grounds that the nurses were on a go-slow. It has also recommended that further action be taken once the copies of the contractual agreement between Pumwani Maternity Hospital and the Security Services Company be availed. The report further recommended protocols and standard procedures to ensure ease of access for patients. This include the gate to remain open at all times except between 7 p.m. and 6 a.m. All security officers report to the administrator or their representative at the beginning of every shift. Retraining of health workers in all NMS facilities offering maternity health services, and that any instructions concerning closure of hospitals to security teams should be in writing from the hospital management and authorized by the head of Health Service Directorate of NMS. On promotion of fair welfare and remuneration of health workers, the NMS recommends harmonization of terms and conditions for all health workers. The NMS maintains that the county government is yet to hand over a record of all contracts, bills and records of stalled and ongoing projects, which has hindered assessment of pending bills, contracted service providers such as security services, and completion of stalled projects. Members of the civil society have also called for the NMS to account for how it has used funds and also called for the county government to resume functions ceded to the NMS.
Tunataka kuuliza Meja Generali, hizi pesa unapeleka wapi? Wananchi wa Nairobi wakiumia, hizi pesa za Nairobi unapeleka wapi?
Hiyo ofisi ni ya wananchi, na kaa ukijua sisi kama wananchi tunajua yoyote unafanya.
Dorcas Wangira, Citizen TV, Nairobi.